Welcome to the Question of the Week series with Pass the OT. Let's test your knowledge and strengthen your NBCOT exam skills. This week's question focuses on psychological conditions and interventions. A client who has recently been diagnosed with schizophrenia and prescribed antipsychotic medication. When the client comes to their occupational therapy session, they inform the OT practitioner that they are having difficulty controlling their eye movements and feel as if something is making them blink their eyes rapidly. What is the most likely reason for this client's behavior? A. The client is experiencing an episode of psychosis related to mania. B. The client is experiencing a common side effect from their meds known as tardive dyskinesia. C. The client is experiencing an auditory hallucination. D. The client is attention-seeking. Take the next 10 seconds to think through your answer, or pause the video if you need more time. B. The client is experiencing a common side effect from their meds known as tardive dyskinesia is the correct answer. Tardive dyskinesia is a neurological syndrome that involves involuntary movements. Taking antipsychotic neuroleptic medications is the main cause of this condition. Tardive dyskinesia affects the facial muscles, tongue, neck, trunk, and limbs. Involuntary movements of the facial muscles may include lip smacking or sucking motions with the mouth, grimacing or frowning, sticking out the tongue or against the inside of the cheek, chewing movements, puffing of the cheeks, rapid eye blinking, blepharospasm. Why are the other options incorrect? A. The client has been diagnosed with schizophrenia and not schizoaffective disorder. Schizophrenia is characterized by hallucinations, delusions, and/or disordered thinking. With schizoaffective disorder, these symptoms are also apparent, but additionally, symptoms consistent with episodes of depression, mania, or both are present. C. Although hallucinations are associated with schizophrenia, the client does not describe being told by a voice to blink their eyelids, which would indicate auditory hallucinations. D. The client's involuntary blinking at a rapid rate is consistent with tardive dyskinesia, which is a very common side effect of antipsychotic medications. There is, therefore, no reason to assume the client is seeking attention. Thanks for watching, and be sure to join us for another Question of the Week from Pass the OT.